All right. So we're going to continue with the appendicular skeleton. Let me get my slideshow going. There we go. And so the appendicular skeleton is basically the pectoral girdle to the fingers, so your shoulders to your fingers, and the lower appendicular skeleton we'll talk about later, which is basically your hip to your toes. So the pectoral girdle connects your upper limbs, so your arms, to your trunk, and it consists of 2 clavicles, so your collarbones, and 2 scapulae, your shoulder blades. So one on the right side, one on the left side. So right here is this pectoral girdle, the clavicle, and the scapula, this triangular shaped bone. We're going to start and talk about those. Basically, the scapula has some structures that are really important. And again, there's some stuff listed here, but I want you to understand, I'm going to focus on certain structures or certain processes that I think are most important. So follow with me. So if you're looking at the anterior view of the scapula, so right here's a scapula, much larger. This is anterior view, so it's facing kind of forward. There's a medial border that sits closer to the vertebral column and a lateral border. And on the same side as that lateral border, there's this cavity called the glenoid cavity. What bone articulates with this glenoid cavity? Take a look up here. There's a triangular shape, same shape, doesn't get twisted around, heads right out here. What bone sits right here? Think about that as we move forward. There's a couple of processes I want to point out where there's some pretty important structures that you can actually tell the anterior side from the posterior side. So here's the posterior side now. Now this guy is flipped around, right? You can still see right here's the glenoid cavity. So this is medial, and this is lateral, right? And the lateral side kind of pokes out toward your arm. What bone sits here? If you said humerus before, you were right. The spine of the scapula. So pat yourself on the back and feel your scapula. Can you feel that kind of bony ridge on your shoulder where your shoulder blade is? That's the spine of your scapula. And the spine of your scapula ends out here at a process called the acromion process. Above the spine is the supraspinous fossa, so above the spine. There's this indentation here that is the supraspinous fossa, and down below is the infraspinous fossa. There are 2 muscles, one called the supraspinatus that resides in this fossa, and the infraspinatus muscle that resides in this fossa here. Both of those muscles cross the shoulder joint, and your shoulder joint is the glenoid fossa, basically, and the head of the humerus. And they attach to the humerus, and they can rotate the humerus. Those 2 muscles are helpful and partly responsible for laterally or externally rotating your humerus, your upper arm. There's the glenoid cavity and 2 processes that are really important. So here's the lateral view. Right here's the glenoid cavity. So the bone that would articulate here is the humerus. Really important bone marking. And then the acromion process and the coracoid process. These 2 processes are points of attachment for ligaments that make up the shoulder. There are some ligaments that are really important. So if you're ever a baseball, basketball, an athlete that throws a ball, those ligaments are really important that connect to those processes. There's ligaments that also connect to the acromion process, ligaments and muscles that attach to the acromion process. The humerus, that head of the humerus, articulates with the glenoid cavity. So I'm going to point out some important structures. Again, the wording is here that describes everything, but I want to spend some time on this figure. So the head of the humerus is here. The head of the humerus articulates with the glenoid cavity of the scapula. So now that we have named the scapula, not the shoulder blade, but the scapula, I'm going to use that term from this point forward. And you have 2 tubercles, a greater tubercle that's bigger and a lesser tubercle that's smaller. Some of those muscles I was just talking about, the supraspinatus or the infraspinatus, and some of the muscles from the shoulder attach to the humerus here and can help you move your arm. Between those 2 tubercles is the intertubercular, between the tubercles, groove. There's a tendon that runs up through there. You have a big muscle here called the biceps brachii. The biceps muscle attaches to a tendon through this groove, and then that tendon moves up into the shoulder and actually attaches to the scapula. So your bicep muscle has a tendon that runs right through that groove. And then we've talked about a tuberosity before, the deltoid muscle, your big shoulder muscle. So if you grab a hold of one of your shoulders, you're basically touching the deltoid muscle. That deltoid muscle has a point of attachment here at the deltoid tuberosity. On the distal end of the humerus, there are two condyles, a medial and a lateral condyle, that have bony projections above them or on top of them, the epicondyles, medial and lateral. So those epicondyles are points of attachment for forearm muscles. So the muscles that flex your wrist. So try to move your fingers towards your wrist and try to touch them. As you flex them, feel where the muscle is located that's actually doing the flexion of your wrist or extending your wrist. Those muscles, the big portion of those muscles are up in your forearm, and they actually attach at one point to the epicondyles above the condyles, and the condyles in the humerus are the capitulum and the trochlea. So these condyles are points of attachment or points of articulation with the humerus, between the humerus and the bones in the lower arm. So the ulna and the radius. So the capitulum articulates, is the condyle on the humerus, that's the lateral condyle on the distal end of the humerus that articulates with the radius. The trochlea is the medial condyle that articulates with the ulna. And I'll show you that here. So right here, there is an epicondyle and an epicondyle here laterally. So these structures here are the condyles of the humerus. The epicondyles are above that. Epi's on top of, right? So anteriorly on the humerus, you can see the trochlea, it kind of looks like a spool of thread. And then the capitulum is a rounded area where it looks like you could put a hat or a head, right? Hang on one second, I'll show you what that means. And on the back side, there's a big, huge fossa called the olecranon fossa. And we'll talk about why this is called the olecranon fossa here shortly. So, well, actually right now, the ulna is your forearm bone. The olecranon is the point of the elbow that projects into the olecranon fossa. So there's the ulna. I'm going to skip to the next here. Can you see the ulna? The head of the ulna has this kind of C shape to it. The olecranon is at the top of this C. So touch your elbow where it bends, that big pointy part of your elbow. That's the olecranon process on the ulna. So think about it. Flex and extend your elbow while still holding on to that olecranon process, the bump at the back of your elbow, the big pointy projection of your elbow. When your elbow flexes and extends, this, where's my cursor? This C shape is what glides, back a couple of slides, glides along this trochlea. So think about that C shape cupping around the trochlea and allowing you to bend and extend your elbow. So that's the olecranon process. The trochlear notch is basically that C. So remember, the trochlea is the condyle on the humerus where the ulna articulates. So the trochlear notch on the ulna is what articulates with the trochlea on the humerus. So this C, this notch here is the trochlear notch. That's what, right? So the trochlea on the humerus would fit right here. The capitulum on the radius, or on the humerus, would articulate with the head of the radius here. So those two condyles basically create the other side of the joint. And this olecranon process has to fit inside, back 2 slides, fits in this olecranon fossa. So when you extend your elbow, go ahead and extend your elbow. The olecranon process that on the top part of the C of the ulna fits right into that fossa. So if that fossa wasn't there, you could never extend your elbow. Weird, right? And on the very distal end, so feel your wrist, the distal end of your ulna, on the medial side, so pinky side, there's a bump kind of posteriorly on your wrist before your carpal bones. That's a styloid process. This end creates part of your wrist joint. styloid process. Actually, over here is a little bit easier to see it. So styloid process is what sticks out kind of posteriorly. If you look at your wrist, the little tiny bump, if you extend your, extend your wrist, so to point your fingers back towards your upper or your lower arm, that bump on your wrist is a styloid process. And the radius, what I want you to know is the radial head and the styloid process as well, because the head is really the most important structure here. So here's the head of the radius. Look at how it's kind of circular but blunted. It almost looks like it's a cup shape. Remember the condyle of the humerus where the radial head fits is called the capitulum, and it's shaped and it's rounded. So the rounded condyle on the humerus is where the head of the radius that's cupped fits right in there, so that you can supinate and pronate, basically turn your hand down towards the ground, which is supination is basically like you're holding a bowl of soup in your hand. So you have rotate your thumb laterally, basically, and place your palm face up. That's supination. Pronation is basically turning your palm towards the ground. So pronation and supination is possible because of the head of the radius and how it fits into the capitulum. And then on the other end is the styloid process, points of attachment for muscle. And on your thumb side, the radius, you can feel the bump at basically where your wrist meets the back of your base of your thumb. That's the styloid process there. And the carpal bones you have in your wrist, I want you to know them as carpal bones. You do not need to know their individual names. There are 8 of them. There's a proximal and a distal row of carpal bones. You should know that there are 8 and know how to identify them as carpal bones. Metacarpal bones and phalanges basically make up your hand. So let's take a look at them on the next slide. So you've got here carpal bones. So you can kind of see 1, 2, 3. There's a 4th one over here. It's hard to see. And then 1, 2, 3, 4. You have a proximal and distal row of carpal bones. These 5 bones are the metacarpal bones. And then your phalanges are 1, 2 on your thumb, 1, 2, 3 on every other finger. So you have 3, 6, 9, 12, 13, 14 phalanges. Onto the lower half. So this is now your hip girdle. We're going to finish the appendicular skeleton here. So this hip girdle, this hip bone, so here's the sacrum, right? We talked about in the coccyx. This big hip bone is actually 3 bones fused together. Your ilium, this big purple portion here, the ischium, the lighter tan portion, and the pubis, or the pubic bone, this pink portion here. So all 3 of these bones, the ilium, the ischium, and the pubis, make up your big hip bone. And collectively, the 2 hip bones with the sacrum and coccyx make up what's called the pelvic girdle. So look at this bone here. See this indentation here? What bone articulates here to create your hip? Hopefully you said femur. If not, we'll show you what I mean by that later. And there are some structures on the hip bone that I want you to know. There's some underlines here, but I think I'm going to focus on just a couple of them because they're really, really important. So follow me to the previous or the next slide. Yeah, there's one hip bone, right? So here's the ilium, the ischium, and the pubic bone or pubis. You've got a couple of things I want to point out. Like the iliac crest is a really big point of attachment for a bunch of muscles. Some of the gluteal muscles, some of the abdominal muscles. So you've got a big point of attachment here for some muscles. That's the iliac crest. That's the big hip bone that you can feel if you kind of palpate the front part of your hip. The acetabulum is this big socket. This big socket is where the head of the femur articulates to create your hip. The only other, I think I want to point out one more. It's called the greater sciatic notch. If you've ever heard of the sciatic nerve, the greater sciatic notch basically allows a passageway for the sciatic nerve to leave the spinal cord and heads down into the leg where it innervates some muscles there. Really important structures. The pelvis, like I mentioned earlier, the pelvic girdle is made up of those 2 hip bones, the sacrum and the coccyx. So at the sacroiliac joint is where the sacrum, sacro, and the ilium, iliac, form a joint, the sacroiliac joint. On the other side of the hip bone is the femur. The femoral head articulates with the pelvis at the acetabulum, that socket that I just mentioned on the last slide. The other couple of structures I want to point out them out on the actual figure, so you can have this slide and the previous slide kind of sitting next to you if you want to. It's up to you while you're listening. So we've got a femoral head. That femoral head is what sits in the acetabulum, articulates with the acetabulum, the neck behind it, and then the greater trochanter and the lesser trochanter, which are easier to see from the posterior view. Here's the greater trochanter from the anterior view. There's a little poking out of the lesser trochanter. Those trochanters are the only two trochanters in the body. They're huge bony processes. Some of the gluteal muscles, you actually have 3 gluteal muscles. So think about your gluteus maximus. A lot of you have maybe heard of gluteus maximus, but you also have a gluteus medius and a gluteus minimus muscle, and those muscles attach there. There's also a couple of other that attach there and help you rotate your hip or adduct or abduct the hip. Mostly abduct, take it away from the body, move it outwardly. And the last structure, I think I want to maybe stop that. The last structure I want to point out is the gluteal tuberosity. There's also gluteal attachments here for muscles. And the linea aspera, this line right here, is a point of attachment for muscles that adduct, bring the legs closer to the midline. We'll talk about those muscles later. At the distal end of the femur, there are 2 condyles that articulate with the tibia in the lower leg to form the knee joint. So take a look at these condyles. You can see them okay from the anterior view, but really nicely from the posterior view. So here's the medial condyle and the lateral condyle. Those condyles articulate with only the tibia, not the fibula in the lower leg. So the tibia on the proximal end also has medial and lateral condyles that articulate with the medial and lateral condyles of the femur. The fibula does not create part of the knee joint, so I'll show you that here on the next couple of slides. There's a couple of structures I want to point out that are listed here, but I want to show you them here. So here's the lateral condyle and the medial condyle of the tibia. So the condyles of the femur would sit right here and right here so that you can flex and extend your knee. So go ahead and flex and extend your knee and think about how the condyles on the femur and the condyles of the tibia basically articulate with one another. And there's the head of the fibula. On the tibia, anteriorly, you can see the tibial tuberosity. So feel just below your knee on the tibia. So find your kneecap and just go inferior to that and find the bump on the front of your leg there. That's your tibia. That bump there is called the tibial tuberosity. That's a point of attachment for your quad muscles, the muscles that are your big thigh muscles anteriorly. Those are your quadriceps muscles. There's 4 of them, and all 4 of them converge to one tendon that attaches to that tibial tuberosity so you can extend your knee. On the distal end of both the tibia medially and the fibula laterally, you have what's called a malleolus, a medial malleolus and a lateral malleolus. And there's only one on each bone. The medial malleolus is on the tibia. The lateral malleolus is on the fibula. Those are your ankle bones. So if you look at your ankle and touch your ankle, those big bumps down in your ankle, that's the medial on the medial side and lateral on the lateral side malleolus. They help create the ankle joint, part of the ankle joint. And the rest of that ankle joint is made up of tarsal bones. Just like the carpal bones, I want you to know them as just tarsal bones. They all have an individual name. You don't need to know that name. 5 metatarsal bones, like the metacarpal bones, but in the foot, they're metatarsal bones. And then phalanges, just like you have in your fingers. So here they are. Here are all the tarsal bones. There are 1, 2, 3, 4, 5, 6, 7. There are, I think, 7, because there's 3 cuneiforms. So you've got 7 tarsal bones. Right here is where the tibia and fibula articulate, right? So the talus bone, this bone here, is where the tibia articulates. And then the fibula would sit right out here. So your medial and lateral malleolus would sit right here and right here. And then the metatarsal bones, there are 5. From the big toe is 1, all the way to the pinky toe is 5. And then you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 phalanges. So you have as many phalanges in your feet and your toes as you do in your fingers. And that is it for the appendicular skeleton. So I will see you for the last really short video on joints. See you soon.